Okay, go ahead.
Good morning, everyone. Dan Bates from the Greater Hamilton Chamber of Commerce, and we are very happy to have you join in Coffee and Conversation. Today, we're starting kind of a new piece of this, which is going to be down the line of Ask the Experts. And this morning, we are thrilled to have President of Fort Hamilton Hospital, Ron Connovich, to talk to us from their perspective, kind of community health and as businesses begin to open and those types of things. So Ron is a very active member with the Chamber and on our board, and we're thrilled to have his leadership. So with that, I'm going to, are we going to do self-introductions or are we going to do that later, Tiffany?
We can do that now.
Okay, so you know who I am. So why don't we start with Tiffany, and we'll kind of go around the Zoom group of who's on. And those of you that are joining us on Facebook Live, we appreciate that you're joining us this morning.
Hi, I'm Tiffany Grab. I'm Director of Membership and Marketing at the Hamilton Chamber.
Laura.
Hi, I'm Laura Merrill with the Greater Hamilton Chamber.
Nancy.
I'm Nancy O'Neill with the Greater Hamilton Chamber.
Rhonda.
I'm Rhonda Croucher, Vice President of Community Engagement for Primary Health Solutions.
Judith.
Hi, I'm Judy. I'm intern with the Chamber.
Okay. Tammy.
Tammy Walton. I'm with the Chamber of Commerce in Hamilton.
Aaron.
I am Aaron Gardner. I'm also an intern for the Chamber.
Did I miss anybody on Zoom? That's all I see. With that, okay, Ron, President of Fort Hamilton Hospital, we're turning it over to you.
Well, good morning and thank you. Since Rhonda's on the line, I will let you say, Rhonda, that you can chime in anytime you want if I say something wrong. How's that? But
here to serve.
I can see you if you roll your eyes. Just remember that. No, this certainly has been unprecedented, as everybody knows. And the good news is, I believe Ohio has really reacted responsibly under the leadership of our governor. And with that, we have not seen the outbreaks that we have seen in other parts of the world or country. So here in the Cincinnati or greater Dayton area, either one, we have not seen the large surge that has occurred in Detroit, New York, etc. So actually, I believe, and according to what we are looking at, we believe that we are over the hump, if you will. There are still cases out there by no stretch of the imagination is this behind us. In fact, we anticipate this going on for months yet into the future. So good, bad, or otherwise, I think it's here to stay for a while. Here at Fort Hamilton Hospital, we did a number of things. We opened up a specific COVID unit. So we had a unit here that was staffed by dedicated nursing and other staff that managed those patients that were admitted with extreme respiratory distress and other things that required hospitalization. We are actually downsizing that unit at this point, and as of this morning, I checked and we have no patients in-house with COVID-19. So that is good news. Like I said, I believe we are over the hump. We will continue to see patients as we go into the future, though, I'm sure of it. All the standard precautions that you've heard on the news, I am not going to review any of that with you guys. I'm sure you have heard more than enough of that. As the governor has said, as you go out in public, a mask is now highly recommended or required. So if you come to the hospital, so as of yesterday, hospital services are opening back up. So when the governor had closed surgeries, anything that was not threatening to life or limb, we did not perform. So as of yesterday, we are now opening back up and our surgeries are now being scheduled. So we had a full surgery schedule yesterday. We have a full surgery schedule all week this week. We are primarily doing outpatient surgeries unless they are emergent inpatient surgeries. So outpatient surgeries, but if you have other tests, radiological tests, mammograms we are now scheduling and people are coming in for those. Any of those, we are slowly ramping back up and bringing the public in. Some people have asked, oh, why do I want to come to a hospital? Isn't that the most dangerous place? It's actually probably one of the safer places. The healthcare organizations around town and around the communities are taking extra precautions to make sure that everything is disinfected, We use a number of systems. Clorox 360, we use a hydrogen peroxide system, all these things to disinfect complete rooms, equipment, spaces. All staff members and visitors are wearing masks. We're wearing all the protective equipment, personal protective equipment that is that would be necessary to keep everybody safe. So honestly, a hospital is probably safer than going to Kroger's at this point. So there's a number of things else going on. So we are in partnership with Kroger Little Clinic. And today, tomorrow, and Thursday, we are doing COVID testing for the community. You can go to the Kroger Little Clinic website and sign up. It's called krogerhealth.com/COVID testing. And when you go on there, they will have a few minor short questions. Are you experiencing any following symptoms? And they're following the CDC guidelines. So fever, cough, mild shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell. If you answer yes to any of those, you can schedule an appointment. It is a drive-through, so tents have been set up. You come to the Fort Hamilton campus, you'll see the signs, you'll be directed by the staff that are outside. You will get your test results within 48 hours. If you are a healthcare worker, doesn't matter where, doesn't matter who, you automatically can be tested at your choice if you want. Now there's multiple types of testing. So there is antibody testing, which tells you whether you have had COVID in the past. What your body does, just like any illness with a virus, it will build up antibodies to that virus. And it will tell you whether you have had that in the past because you have built up those antibodies. This is not an antibody test. This is a test that will measure the live virus in your system. So it will tell you whether you currently have COVID. It will not tell you whether you've had it in the past. But a number of people have questions and they're concerned. So we have worked with Kroger's and made this available to the community. And it is open right now as we speak. So I would like to say that we are slowly getting life back to normal. I would like to hope by the end of the month that this will all be behind us and everything will be fully scheduled. And we'll talk about this with our grandchildren someday about, do you remember when we closed the country down? But I think the worst is behind us and we are moving forward. So with that, that's kind of a brief view and summary. I will open it up to questions and anything you want to ask. If I don't know, I'll make something up. How's that? Any questions from anybody?
Ron, I have a question. How do you, with businesses beginning to slowly reopen, do you as a healthcare professional have concern that it's going to elevate cases or just kind of things will continue moving on as they currently are?
I do not personally have a concern that it's going to elevate cases. It may have a slight bump, as you've heard the governor and the physicians talk on the news. We are slowly developing this herd immunity. And so people that have had it are not typically going to contract COVID again. So as those who have had it in the past, they are not subject to really getting it again. And so you have this, what we call herd immunity. And so as you're out and about in the community, we don't see that large surge coming. As I go to stores and other places that have other people, standard precautions are appropriate. Wash your hands when you come out of the store. Wash your hands or use the alcohol hand sanitizer. Don't touch your face, your eyes or your nose. But we don't have a concern of that at this point in time. We believe that we're moving forward. Other questions?
Hey, Ron, when will the
Yeah.
testing be available for the antibodies to tell if you've had it in the past?
Well, the testing is available. It's out there. We don't have that here in the community at this point in time. As soon as we get that available, we will make a news announcement and we'll tell the community about that. And all testing is limited to some extent. So even when you come to the Kroger Little Clinic testing site today or tomorrow or Thursday, you need to follow the CDC guidelines because, again, testing is limited. I would assume testing will be limited in all test forms for some time into the future. But as soon as that becomes available, we'll let you know.
Okay.
Ron, I have another question. There's been
Sure.
some, all along this was a droplet-borne virus, and then they started talking about that there's some indication that it's also has become airborne. Is that true or not?
There's a lot of different speculation out there. I try to limit myself to the studies, and the studies I have read at this point, they may contradict themselves in the future, but the studies I have read, it is not airborne. So it is droplet. So as the governor is requesting wearing masks out in public, really that is to protect the droplet spread. So if I cough or sneeze, I am not sneezing or coughing on somebody or on surfaces. So the virus can live quite an extended length of time on surfaces. So let's say I sneeze or cough on a grocery cart. I finish checking out, I'm done, I put the grocery cart back and someone else touches it. That can be a problem. And if they rub their eyes or nose, and then that's how it spreads. Also, we know that the majority of the spread has come from asymptomatic patients. In other words, you may have the virus, but you have no signs or symptoms at this point, or you may never have signs or symptoms, but you are still contagious. So that is where the majority is being spread. But as far as I'm aware, it is not airborne. Masks are really to prevent the spread of droplet.
So I have another question. With that being said, I see people, in their cars and, on the sidewalk, wearing masks. And, my personal take has always been that the masks are really when you're going to be around other people or, inside a building or whatever. Can it be somewhat detrimental to people's breathing when they're out, walking and exercising and trying to wear a mask?
It can be. I have seen people actually trying to jog or run with a mask. It can certainly impede the flow of air or oxygen. So it probably, I don't want to contradict any of the recommendations that have been out there as you're out in public, to wear a mask. But depending what type of mask you wear, you can wear a surgical mask, you can wear an isolation mask, you can wear a homemade mask. You can wear an N95 mask. All of those have different permeabilities and subject to different airflow. So just be cautious if you get dizzy. Slow your exercise or whatever you're doing. Even remove the mask if you need to. It's better than falling over for a lack of oxygen. If you wear a mask for a while, you'll realize how difficult it is to. I absolutely hate it. And we have a policy here in the hospital, and I wear it. I don't have it right now because I have my office door open, or closed rather. But when I go out of the office, I put the mask on, and it really wears on you as you wear it all day long. So think about the healthcare workers that are wearing these masks 12 hours at a time. It can be very difficult.
Yeah, I don't know how they do it. I, wore one at like Findlay Market and the grocery store and stuff like that. And by the time I got to the car, I was ripping it off my face. I couldn't take it anymore. And that was only for, like an hour or 2 hours. So kudos to the healthcare workers who wear them all day. I don't know how they do it.
Yeah, I give them a lot of credit. And actually, it is Nurses Week this week. So if you know a nurse, thank them for the work they do. We aren't having the typical big celebration because we're trying to keep the gathering of people to smaller groups. But if you see a nurse, thank a nurse. Any other questions?
Well, since nobody else is asking, I have another one. So, there's also been speculation that the virus will, return, or we'll see another, at least a minor surge in the fall. Are the healthcare facilities like Fort Hamilton, do they have a plan for that, or do you think it's a wait and see, or what's going on with that? And what should we, as fall begins to arrive, what should we as citizens and business owners and things, what should we be looking for, paying attention to?
Sure. No, that's a good question. All the hospitals in Dayton and Cincinnati, we work through our health collaboratives, whether it's the health collaborative here in Cincinnati or Greater Dayton Hospital Association in Dayton. And we have collaborated together and really putting out plans. We have taken this to the nth degree. What happens if we have a massive influx, and we've taken this to if we need 5 times the number of ICU beds that we currently have capacity for, and how do we do that? How do we stand up freestanding centers, etc. So just know that we have planned with the National Guard, etc., etc. So there's been thousands of man hours put into planning and putting processes in place in case something like that would happen here, and we are fully prepared for that. So that aside, I will tell you that, yes, any of the epidemiological studies that I have looked at, there will probably be another smaller surge in the fall. It doesn't just take a flat line down. You see the humps, and it slowly declines with humps along the way. So I would expect to see some upticks as we go into the future. But again, because of the way that Ohio has responded to this, I don't anticipate this being a major issue for us here in the state of Ohio. And the healthcare systems are all fully equipped and ready to handle this. So I think we're good. Other thoughts?
Ron, are they estimating what our herd immunity could be by this time in our area?
Yes, they are, and the numbers range quite dramatically because they are just estimates. Until we can actually test, we're not going to have an accurate understanding of what that herd immunity is. I've seen numbers ranging anywhere from like 15% up to 40%. So that's a pretty big gap, but certainly it's out there, and it's improving. So.
Ron, we have a Facebook Live question. Jim Goodman said, I've heard that some people showed no symptoms but are testing with antibodies like they've had it in the past. How does this happen? And does this question whether this is a novel virus or possibly something like misdiagnosed flu that has been around?
All right, good question. So the name novel means, it is unique, it is new. Next year, it won't be called the novel coronavirus. There are a number of strains of coronavirus. So as you get the COVID-19 coronavirus, you may have had it in the past, so let's say this past winter, and you just thought it was a normal cold or flu, and you didn't think much of it, and you recovered and everything was fine. So you would have the antibodies in your system. They are also speculating that people are actually getting the virus in their symptoms and having no signs or symptoms, and building up the antibodies and moving on with life. So there's a lot that we don't know still, but clearly it's become apparent that a number of people are getting the virus, and really it's no big deal at all. So we don't know the exact percentage out there, but again, that percentage, I think they're estimating. There was one study I read, it was about 18% of the population had no clue that they had the coronavirus. Good question.
Ron, what's the recovery like for people? I know we talk a lot about people getting it and how that all is working. I actually know a couple people that have it. One was diagnosed, one was not officially. The first lady, she's in 30 plus days between her initial symptoms, and then she did have 6 days in the COVID unit, and then she's probably 14 plus days after that, and still not necessarily out of the woods.
Yeah. It can drag on, and it varies dramatically from person to person. It really depends on your comorbidities or the other things that you struggle with, your other diseases or that you might have, and also, you know, your age, your health, your general health. So like I said, some people will get it and have very minor signs or symptoms or no signs and symptoms, and they go on with life. Others, this is stretching out a good month. So when you are admitted to the hospital, it is primarily because of severe respiratory problems. It can progress very quickly where you need to be put on a ventilator, and so watching that is very important. And so primarily the ones that are hospitalized are only patients that have respiratory distress that would need ventilator support. And the rest of them we discharge or we send home. They may present to the ED. We may or may not test them depending on what is going on and how severe it is. And we just send them home to convalesce and stay quarantined. So yes, for some people it can last a good month. There's no doubt about it. And once it gets into your lungs and you start having the respiratory distress, you can actually see it in a CT scan. You see in the periphery of the lungs, you can see a buildup and kind of the constriction of the lungs there. So that's where it's causing problems. That's how it starts anyway, and then it causes worse problems in the lungs. Any other thoughts, questions?
Ron, can you give that link again for the little clinic?
Yes. So if you are out there and you have opportunity to hear this or watch this, or you're listening live, KrogerHealth.com/COVID testing. That's COVID testing. And they are available Tuesday through Thursday of this week, May 5 through 7, from 8:30 till 5:30. If you go online at the site that I gave you, that is KrogerHealth.com/COVID testing. I'm going to ask you a few minor questions. You can make a quick appointment, and you can drive through. It's very simple. You make no contact with anybody. You'll roll down your window. They will hand you a swab. It is a nasal swab, so you'll stick it up in your nose. And it can be uncomfortable because you need to get it up there a ways, but that's the process.
Ron, can you talk about the recent conversations about the blood and blood clots and you know, is there anything to that, or what's going on with that?
You know, I can't really speak to that, Dan. I'm going to leave that to the clinical people. I am not up to speed on that, and I couldn't tell you specifically, so I'll leave that one. Rhonda, I don't know if you have any comments on that specifically.
I am non-clinical, so I do not.
We're going to avoid that one.
We're in the same boat here.
Ron, I just heard of something this weekend called COVID toe. Have you all seen any of this coming in? Apparently my brother was thinking that she may have had that, but she's a healthy 25-year-old and that was her only symptom, you know, and they're not certain of it, of course, so.
We have not seen it, no. I have read about it. I have not seen it yet, so.
Yeah, it was just such an interesting, strange thing, so, yeah. So they'll be interested to see when she gets an antibody test if she had something or not. Yeah.
Couldn't tell you. They're saying in children, sometimes the signs and symptoms are different. Children are very resilient and they might get a small rash or some other things. We haven't seen that either, so. All right. Well, guys, I want to ask you to stay safe. Remember to wash your hands frequently. If you're using soap and water, antibacterial soap is wonderful. Wash for at least 30 seconds. Don't touch your eyes or your nose. And when you go out in public, according to our state, try to wear a mask. So, all right.
Thank you, Ron. Thanks for joining us.
Thank you.
Okay, any other questions or comments about Corona or anything else that's going on out there? I know there's article in the paper today, and there's the press was desperately trying to do a story on the big reopening yesterday. And I don't know if anybody watched the news this morning, but basically there is no big story because they had the weather on twice as much today as they normally do because they had nothing else to talk about. So, you know, with construction and manufacturing and hospitals, none have been completely closed. You know, as Ron said, hospitals are certainly in a position to start doing procedures they were not allowed to do before. And, you know, construction that was just commercial is now able to do commercial and residential, and manufacturing with some different protocols, you know, is moving forward. I know some of them had to quit manufacturing certain unnecessary products, and now they're all back online. But, you know, from what we're hearing, it's not a big change or shift, or, you know, there's not thousands of people out on the streets, you know, with this slow opening as it begins. So I know Jason Crank, you know, from United Health, United Homeland Insurance was also quoted in the paper and was on Channel 12, I think it was. United Heartland, that's what it was. And I'll get the name right eventually. Talking about, you know, protocols they have in their office, that they are installing some plexiglass shields when people come in to either meet with someone or, you know, make a payment or something like that. So has anybody else heard anything that is new, different, drastic, you know, whatever out there? I know we had Channel 5 and Channel 12 here at the office yesterday, and very interesting. You know, Channel 12 was in the office. Channel 5 has a policy where they won't go in any offices or homes or closed environments. So it's just kind of interesting. So and everybody's, I think, trying to adhere to safety protocols. Even though a lot of people have very different, you know, approaches to that. So anything else? I know here in the office, we have, every time I find sanitizer spray, we have 3 different brands here now. So when you are in the office, don't hesitate to grab a can and spray your air, and certainly spray your way out the door and all that type of stuff. So I travel with my Lysol. But we also have 2 other brands whose name I forget at the moment, but Claire's or something like that is one of them, which is a commercial brand that I got from a trucking company, and then other things. So anything else anybody wants to talk about this morning? It's coffee and conversation. I'm having water and conversation, so
Good for you, Dan. That's healthy for you.
well, I did have my iced tea this morning, so Rhonda, you guys started, you know, greater testing, like last week, or, you know, do you want to just talk a little bit about how that's been going, or what's been the, you know, public reaction to that?
Yes, we have been testing. Actually, we've done over 250 at this point. And we, too, are able to turn around lab results within 24 to 48 hours. Also, we also have in the plans to do the antibody testing. So I think, you know, in partnership, it's a great thing for all of us as healthcare providers to be involved with as much as we can, because as Ron talked about, herd immunity is what we're aiming for, and the more we know about those who've already had the virus and can move about more freely, I think the better. So for us, you know, we're committed to continue to move into places and spaces where we need to be, you know, just as Fort Hamilton is. You know, we're here to serve the community entire. So As you know, Fort Hamilton has launched in this arena, we have as well, and I see that we will be continuing to do so, you know, for this next year, 2 years, whatever we need to do. So we have mobile sites, much like Fort has established. We feel like that's the safest way to do the testing is outside of our centers. We actually have someone, we have partnered with First Financial. They have allowed us to use one of their sites on Dixie Highway, where if you drive on Route 4 today, you'll see our mobile dental unit. We kind of use that in the drive-through situation. The difference is that our providers are actually doing the testing, so that we're not doing the self-testing. Our providers are actually doing that, and we should have some antibody testing available in the next week or so to the public at large. We are doing some of that with healthcare teams, and you know, so we do this in steps. Much like everyone else, we're trying to meet the criteria and do what we're asked to do in terms of preserving testing for those who need to be tested.
Do we have any questions out there, Tiffany or Laura?
No.
Well, I have one I'm going to throw out if anybody wants to talk about. You know, in anything like this, there are, you know, obviously many challenges and, you know, negatives, but there's also some positives. I think that a lot of positives that have come out of this whole COVID-19, you know, issue. And, you know, one of the things that I know that we've been talking about is, you know, people forced to discover that technology can be a great tool, certainly in the business world, and it sounds like in the medical world as well. So we've stayed remarkably connected, and some people feel they've had better, closer connections being separated from people than they have been when they were face to face. But you know, so if anybody wants to just, you know, talk to that. I think the other thing that I know I have found is the collaborative conversations that happened among groups that never collaborated before. So, you know, I know one of the things from the chamber perspective is from day one, we have worked very closely with Butler County Emergency Services, and there for a time was having conference calls twice a week with them. Now all the chambers in Butler County are involved in that. And we have, because as the crisis, you know, the urgency of the crisis winds down, that has become a weekly call. But I think what we found is even though we're in two completely kind of different worlds, is the magic of what can happen when we work together. And, you know, we became unlikely partners. And I think it's a partnership that we certainly aim to keep alive and move forward. And I think what emergency services, you know, learned a lot from us, and we learned a lot from them. But they also found that, you know, chambers can really get a lot of information out to a very broad-based community perspective very quickly. And so I know they've utilized our reach to get a lot of messages out, and even looking for, you know, personal protective equipment and, you know, all kinds of things. So I was, so not to belabor that, but I just think that's very interesting. And I think that there's been some relationships formed that under any other situation probably would have never happened, that are positive.
I have a random, Rhonda, this might be something that they talk about on your Mental Health Monday. They may have already. I was talking to a friend this week on the phone, and we were talking about how, you know, everybody, a lot of people went through kind of those stages of grief during the shutdown. You know, now that we're kind of in this normal of, you know, sheltering in place and working from home, is that going to happen from a mental health perspective again once everyone is back into the office and, you know, kids' sports kick up again, and then you're constantly on the go again. You know, are we gonna go through that wave again of, you know, those stages of grief?
I think that's a really great point. Actually, we talked about this a little bit yesterday. We did our whole segment, you know, asking people, how you doing? Because I think that's going to be the question over and over in the next year. People, you know, everybody has their own sense of fear and or anxiety, or even if you tamp that down and say, I'm not afraid or what have you, you know, life is different for people. And I think we're going to see waves of grief. We're going to see waves of fear and having to work through. And honest, guys, we've all been traumatized by this experience. This is unlike anything else anyone has ever had to go through. So yesterday we were talking about, you know, how are you doing? And it was a good conversation. And next week, you know, we feel like it's important to talk about joy, because we have to move beyond the paralysis. We have to get out in our community. We have to begin to live again. And how do we have joy now that we've been through trauma and we've had all these, you know, weird, wild experiences, and we're grieving the losses of, you know, I know we've got folks in our on our staff that are, you know, extremely traumatized by not having baseball and soccer and all that, you know, having those experiences with children and loved ones. I mean, and honestly, there are people who have grieved in reality. They've grieved the loss of loved ones, and they've not been able to be by their bedside. I mean, that's the reality of what people experience. It's from what we may view as, if we've lost a loved one, we may say, well, loss of a soccer season is not so minor, but it truly is for families. You know, you'll never get this time back with your children doing those things that are quote unquote normal, right? So I believe, and I know Ron can speak to this as well, mental health is going to be part of our moving forward, you know, taking care of ourselves, and people being able to speak up and say, hey, I'm not okay. It's okay not to be okay. And I think the more we talk about the mental health struggles and the challenges and the hurdles that we're going to be walking through in the next year, helping our children with, I think the better we'll be in terms of actually transitioning to some new normal. Any comment, Ron? I know you're non-clinical as I am, but we hang around with a lot of good clinical folks.
Yeah, we have certainly seen, you know, life has changed as you've described it. Unfortunately, we have seen a lot of domestic violence. We've seen a lot of things coming through the hospital that are increased from before COVID. So opportunities to get outside, sunshine, exercise always reduces stress. All these things are good. It's a time to probably think positively and establish new healthy habits. You know, establish an exercise routine. It always improves your frame of mind. It is great for your health overall. And sunshine is always a good thing. So I'm encouraging everyone to get outside. It just changes your whole perspective. For the few days that Ohio has sun, go get some.
There you go. It's important. You know, we talked week before last also about the importance of faith. And I know with Fort Hamilton, with KHN, you know, faith is a component, looking at that mind, body, spirit connection, all of us as humans, fully living again. You know, we've been denying ourselves. We've been separating ourselves and just connecting mind, body, and spirit. So important, you know, to live holy and to live well. You know, personally believe that, and I think just, you know, the data supports it. We all need that.
You know, I can add on to that. Most churches are closed, like everything else, but if you're not a church-going person, this is a very unique opportunity for you to join online church where you don't feel if you're concerned about pressure or interacting with people. Join an online church and experience that, because as Rhonda expressed, the spiritual component is also very, very important. So when you're looking at establishing new habits, I would encourage everyone to, beyond exercise, to also establish a habit of reading your Bible. If you're of that mindset that you believe that this world is going to come to an end at some point, which I am one of those. I believe that Jesus is going to return, and there's going to be other things that happen before that event. And I am anxiously looking forward to it, and I'm excited about it. And I think the things that we see going on in the world, not just COVID, but a lot of different things, really tell us how close we are to that event. And so I would encourage you to take the time that we live in seriously.
Not a time to be afraid. Time for faith, hope, joy, love. I think we can love our community better as a result of some of the things we've experienced in this loss. The loss of human connectivity can actually catapult us into a time where we love one another and appreciate one another and care for each other in a more significant and substantial way. I know that's kind of my personal experience. Introvert by nature, always having to work as an extrovert. It's been an interesting time. But sincerely, I think, those of us, especially in the healthcare space, we don't get into it without wanting to serve people. And it's not because we don't, it's because we care deeply. I think that we can use this to love our jobs more, to love those we serve more, to serve each other better, even in the healthcare space.
Well, it comes down to balance, and those who know me are probably going to find this quite interesting, but it's okay to check out once in a while and kind of reestablish your priorities, and it's okay, to say, family comes first, and I may love my job, career, or whatever, but it's okay to make other things more important, and keep that in balance. And I think that, maybe that's another kind of lesson we've learned, that we can take a step back, and it doesn't close down your business. There's ways to make things happen. The whole 9 to 5 mentality, I think, has probably been, I hope, actually, has kind of been destroyed. It's more about what needs to happen, what needs to get done, and what do you need to make that happen. And if you can do that, in a day or 2 hours, or, 1 o'clock in the afternoon or 9 o'clock at night, that kind of doesn't really matter. It's just, so I think that's been a good lesson learned, that it's, flexibility is key.
I love that word, balance. We're not always good at that. I'm not always good at that. And it's easy to get out of balance and make the unimportant the focus or the primary. And I think this has been a great time for people to reassess and to kind of set the vision for the next. That's a word that I like. And actually this morning, just, thinking about preparing in my personal time, my devotional time, vision was a word that I was kind of meditating on. What do I want for the next? What do I want the next chapter to look like? How can I prepare now in the quiet, and in this time of being more still? I think that's really important, not just personally, but in your business. Thinking about your next, you can reinvent yourself for your next. just laying out the plan and thinking about what it takes to get there.
It's a learning curve for, I know it's certainly a learning curve. I'm terrible at balance, so I'm like the worst at balance. So it's been an interesting time. I think the other thing that's kind of interesting is, you know, especially in the workplace, there's this kind of clashing between the people who have been sheltering at home, and you know, many have been laid off and that type of thing. And so when I see on TV every day people talking about all these things to do with your kids at home and how you're filling the time, and you know, so many others have had no downtime and have been on the front line. So there's this kind of clashing of, you know, everybody's focused on how everybody's at home with nothing to do. But there's another whole side of people who've been on the front line, have been working through this, and have been even more stressed because they are on the front line. It just, you know, kind of looking at the others saying, you know, I haven't had any downtime, you know. So, you know, if you know, you're a healthcare worker or something, there's been no downtime. And even if I look at like our public utilities here, you know, with the city and that type of thing, you know, those people have not been laid off. They've been out there working every day. And, you know, that comes back to, I think, the stress that maybe they haven't accepted that they're dealing with. So I just think it's interesting what that looks like when people come back to work. There's going to be this whole group of people saying, man, I'm so glad to be back to work. And other people are saying, I need a vacation, you know. So it's that's going to be an interesting mix, I think.
I agree. You know, my house, there are 4 adults here because we have one of our children and their partner living with us. And 3 of the 4 adults are considered essential workers. You know, we have one who was furloughed from her position, but the rest of us have been business as usual. And this is the first full week I've actually worked at home. I've been going into the office. So, you know, just being honest, you do mentally struggle with all of that. You know, what does this mean for our household health? But thankfully, you know, it's been well. We've been well. But we've had no problem hunkering down on the weekends and you know, not running around for a while because we've been so drained of being out. You know, and that's part of the conversations we're going to be having. There are those of us who are mentally going to be drained. You know, the Chamber's done a tremendous job of staying on the forefront and helping business. And, you know, I just want to say, you know, the bulletins that come out, the encouragement, the resources has been phenomenal for us, for our organization. It's helped to keep us moving. And so when you think about essential, it's not just us in healthcare. There are, you know, people who repair and people who manufacture and people who keep the lights on. You know, there's much love and appreciation for those folks as well. Because I know, like at my house, I have, you know, people who are in manufacturing, people who are repairing appliances and fixtures and things. You know, the housekeepers, you know, at the hospitals, the people who are doing the disinfecting of spaces and places. I mean, there's all kinds of essential work that's going on. And I think probably some of those folks, especially at the lower pay rung, are really struggling. You know, here I am working very, very hard and actually could make more money on unemployment because of benefits to some folks. I mean, that's a conversation happening as well. There's a lot for us to, as a society, that we're going to have to digest and dig out of. That's where that kindness, love, wisdom is going to serve us well in the days ahead. And I think the more we talk about these things, the better we are. You know, just get it out. Let's work on it. Let's work on it together.
Ron, we have a question from Facebook Live. Mallory Scott is asking, the current COVID testing that's happening at Fort Hamilton in partnership with Kroger, what is the price for that testing for community members? Is it a free testing site or is it something that's billed to insurance or out of pocket?
That is a very good question, and I should have the answer to that. I know for healthcare workers, it is free. So if you are a healthcare worker anywhere, any kind, just go onto their site, log on, and go through that quick screening tool and schedule it. For others, I am not sure, and I am going to see if I can find it real quick while I'm talking. I actually wrote that question down because as I was talking, I was thinking, oh, I should have that answer. I don't see it on the initial screen here. So how it works, find out if you need tested, schedule an appointment, activate patient portal, get tested, and then review your results.
Okay, we can always look that up, and then Mallory, I can put the link underneath your question.
I know that, and I don't know how the individual step-by-step process works. I know on a national level, COVID-19 testing is supposed to be covered by all insurance providers, and I know that the federal government is reimbursing, they say they're reimbursing hospitals for people who were tested that had no coverage at all. So there should not be any out-of-pocket expenses on the patient side or the healthcare provider side for COVID-19 testing. At least that's what they're saying. How that actually works on the front line, I don't know, but that's what's been said. So. Dan,
it looks like we're about at 5 till, so do you have any wrap-up remarks or any last?
Well, I guess just, thanks for joining us. Ron, we really appreciate you, chiming in today and giving us your, expertise and expert input, and Rhonda as well. I think this has been a really great session. Not as many questions as I had thought, but, we don't know. Maybe you answered all the questions up front, Ron, so there were none left to ask when you gave your overview. I think mental health as we move forward is critical conversation, and I have been out of the loop of that realm for quite some time, but I doubt that it's changed very much. It's one of our biggest issues and the least funded, and has always been the case. Not just in the state, but at the national level. Everybody thinks mental health is important, but we never fund it at the level that it really needs to be funded in order to address it. So that's always a challenge as well. But I think that, Rhonda and Ron, you bring up good points. This is a really good time for people to feel comfortable in saying what's on your mind. And if you're stressed or just pissed off, that's okay too. And I think it's okay that as we start getting back into offices and businesses, be kind, be patient, and let's really look out for each other. So with that, just thank you for joining us all this morning. And we'll be doing this again the next Tuesday, right? Tiffany, who's our guest next week?
Yes.
Is it Tommy next week? Or?
I believe it's Tommy Long with Lemon Grenade. Yes, Tommy Long with Lemon Grenade will be on May 12th.
So if you don't know Tommy Long, one of the foremost go-to people in the region for marketing, and sometimes, really cutting edge and always unique. And I think he's going to be talking to us about, how we come out of this and how to be telling your story coming out of the crisis. And so it should be a really interesting conversation, not just for businesses, but for anyone. So with that being said, thank you all for joining us. Have a great day. Wear your masks, be safe. And as the businesses begin to open, get out and visit them, go on our website and buy gift certificates for businesses to redeem after June 1st. And once again, thanks for joining us.
Thank you, Dan.
Thank you.